Hello, today we are going to be discussing observation status. So as you can see in my picture here, I have my CPT manual open to hospital observation services. It's on page 20. And let's just kind of talk about the information that we have in our guidelines. Let's read hospital observation services. The following codes are used to report evaluation and management services provided to patients designated admitted as observation status in a hospital. Now, this is important. It is not necessary that the patient be located in an observation area designated by the hospital. Okay, so you may say, what is observation status? Well, I'm gonna just put some paper here. I have found some great information and I'm just gonna read it to you guys. And here you can see that well. So what is a hospital observation status? When a patient is put into the hospital, they're assigned a status: inpatient status or and observation status, which is technically an outpatient designation. These are the most common. When you're admitted to the hospital, it is not always easy to figure out if you've been admitted as an inpatient or considered an outpatient under hospital observation status. Inpatient status is when we typically think of someone being admitted to the hospital. Observation status is a type of outpatient status. However, someone in hospital observation status can spend multiple days and nights actually inside the hospital, even though they're technically an outpatient. In fact, they might be in the very same type of hospital bed, right next door to someone who is considered inpatient. Observation used to be, observation used to be a way to keep someone in the hospital for a short time while healthcare providers tried to decide if they were sick enough to need inpatient treatment. Now, observation patients can sometimes be kept in the hospital for days on observation status. It is easy to see how this can be confusing for patients since we don't tend to think of outpatient as involving an overnight stay in the hospital. Now, please note that your medical records are usually going to indicate inpatient, outpatient, or observation. I'm just giving you some more detailed information on what an observation status is. So here's an example. Mr. Smith comes to the emergency room with chest pain. Unable to tell for sure whether or not Mr. Smith is having a heart attack, the cardiologist, Dr. Jones, puts Mr. Smith into the hospital on observation status. Mr. Smith spends the night in a hospital room attached to a heart monitor. Throughout the night, nurses check on him regularly. He gets oxygen and has blood tests drawn every few hours. Dr. Jones may even have ordered more extensive tests to determine the condition of Mr. Smith's heart. Late the next evening, after 2 days and 1 night in the hospital, Dr. Jones has enough information to determine that Mr. Smith did not have a heart attack. Mr. Smith is sent home. So I hope that that gives you more clarity on what an observation patient actually is. So there's lots and lots of information for you to read through, but we're just going to talk about some of the codes. So let's look at our code 99217, observation care discharge. So this is the code you're going to use if an observation patient is being discharged. So even though it says discharge, I'm going to write here discharge, just because if I write it, I go to it quicker. And also you can tell here in the red, it says observation care discharge services. So if you're being discharged from observation care, if your patient is being discharged from observation care, you're going to use 99217. So now I'm going to give us some more codes to look at. Let's take a look at 99218. Initial observation care per day for the evaluation and management of a patient that requires these three components. Okay, so you're going to see 3 bullet points: detailed or comprehensive history, detailed or comprehensive exam, medical decision making that is straightforward or of low complexity. You're going to see that I've gone through and put D for detailed, and I can do a /C or comprehensive with a straightforward or low complexity. Now, I use these letters and symbols to let myself know I don't have to read through that. So if I get a medical record that says initial observation care for the first day that had a detailed history and a detailed exam of low complexity, I'm looking for a DDL. And so I can look at my scenario and then go to my code, and I know I'm looking for a DDL, and so I know it's a 99218. Now, this may not make huge amounts of sense to you until you get in and start coding some of these scenarios, but I'm showing you how I do it so that when you begin to code, you're going to say, oh yeah, that makes sense. So let's move on to code 99219, which is also observation, but the difference is it's a comprehensive history, a comprehensive exam, and the medical decision making is moderate. So it's a CCM. So the difference between 99218 and the 99219 is the complexity. We're actually doing comprehensive, and the medical decision making is moderate and not low as in 99218. So now we're going to look at 99220. It's also initial observation care, which is a comprehensive history, a comprehensive exam, and the medical decision making is a high complexity. So it's a CCH. Now I am going to turn our page. That's the initial day, correct? So that's on day 1. Those are the codes we're going to use initially. Now say that we're on day 2. We're on day 2. So we're going to be using subsequent observation care. Day 2. Day 1 is initial, and those were what we used here, 99218 to 99220. Now we're moving on to days that are not day 1. So let's look at 99224, subsequent observation care. The problem-focused history, problem-focused exam, the the medical decision-making, the MDM is of low or straightforward complexity. So 99225 is expanded history, expanded exam, and the medical decision making is moderate. So it's an EEN. I'm going to push it forward a little bit so you can see. 99226, subsequent observation care again, but it's detailed and of high complexity. So where does all of this come in? Let's just use our Mr. Smith that we just talked about in our example. So Mr. Smith comes into the emergency room with chest pain. He spends the night. So that initial night is going to be our initial observation care. And let's look. He's being put on a heart monitor. So it's of moderate complexity. So we would do a 99219. That is his initial stay. Now, let's look. So we know that Mr. Smith actually stayed another evening. So this is when we're going to start using our subsequent observation. So after 2 days and 1 night, let's see, Mr. Jones has enough information, and we don't have all the information, guys. You're with the medical records, and the doctor is going to indicate what he wants you to use, but we're just kind of freehanding it, so to speak. And let's say that his subsequent observation, when the doctor went in and saw him and looked at his records and how he did during the day, and he was doing well, everything was straightforward. So we would use a 99224 for day 2. So we have day 1 as a 99219, a day 2 as a 99224. And that's how that works. I hope that that was more clear than muddy water. But if you just go into your CPT the way that I've just told you to, and you label and read your information and get to know these things, you're going to be better off. I do want to make some really quickly on 99224, there is a time. It's typically 15 minutes. So I'm going to highlight that. A 99225 is typically 25 minutes, time-based. Your 99226 is 35 minutes. And I have highlighted that. So I hope that this helped you get to know initial and subsequent observation care, and that you understand what observation care is. Have a great day.